Good evening, and welcome to Georgia's 5th District Congressional Virtual Town Hall on the American Rescue Plan, hosted by Congresswoman Nikema Williams. In just a few moments, we will hear from the Congresswoman, but first, I have a few housekeeping items. For those of you wondering if you are connected, you are. Currently, you are viewing this town hall in webinar mode. Although only our panel will appear on screen, we encourage you to submit your questions using the Q&A feature at the bottom of your screen. When we get to the Q&A portion of tonight's program, the panel will answer as many questions as time allows. If for some reason we are unable to get to your question, the Congresswoman's staff will follow up with you. Now, I will turn it over to Congresswoman Williams for introductions and brief remarks. The floor is yours, Congresswoman.
Thank you, Bernadine, for all of your work in pulling this town hall together. And hello, everyone who has tuned in with us tonight. I know that you have a lot of questions and we have information to share. Thank you to all of our guests for joining us this evening to share your expertise. And I look forward to the opportunity to share information with all of you at home and make sure that we get to as many questions as possible, because I know that many thoughts are looming through your minds as we continue to navigate the end of this pandemic. That's why I wanted to hold this town hall so that you could receive the most up-to-date information accurately about COVID-19 vaccines, the distribution process, about our schools, and individuals and government resources, and how we'll all be impacted by the American Rescue Plan. Be assured that help is here, y'all. We're getting shots in the arms, our children back to school safely, and our economy back open. I was proud to join my colleagues to pass President Biden's American Rescue Plan, which he has now signed into law. I'm sure we are all feeling the effects of it already. Along with getting our students back to school safely and putting money in the pockets of struggling families, individuals, and small businesses, the plan will mount a national vaccination program that includes setting up community vaccination sites nationwide and addressing disparities facing communities of color. It'll also take complementary measures to combat the virus, including scaling up testing and tracing, addressing shortages of personal protective equipment and other critical supplies, and investing in high-quality treatments addressing healthcare disparities. In the relief bill, we also made sure that no one will have to pay more than 8.5% of their income for a silver plan in the Affordable Care Act market, and created new incentives for Medicaid expansion for the 12 states, including Georgia, that have not expanded Medicaid. We get a second chance, y'all, to expand Medicaid in Georgia. So the funds are there, the people need it. We have 500,000 Georgians who could gain access through Medicaid expansion. We just need the political will. The bill also brings more than $4.3 billion in relief for K-12 schools in Georgia. And if you haven't already seen it, individuals will receive economic impact payments of up to $1,400 per person. This is inclusive of the $600 per person that was delivered in December, bringing us to a full $2,000 for more than 6,255,000 adults and 2.9 million children. This is 88% of all adults in the state and 88% of all children in the state. Additional relief of up to $1,600 per child through the up to $3,600 per child through the child tax credit for the families of 2.2 million children, lifting 171,000 children right here in the district out of poverty. Y'all, this bill does that and so much more. If you are one of the people dependent on COBRA for your health insurance, the American Rescue Plan will pay your premiums through September so that you have health care throughout the end of this pandemic. In a moment, we're going to hear from health experts, educational administrators, and representatives from local governments who will provide more detailed information, and I'll introduce them in just a moment. But first, I want to introduce you to my Constituent Services Manager, Jarrett McKinley, who's going to share information with you that's specific to services that we can help you with right here in our office. Jarrett, the floor is yours.
Thank you so very, very much, Congresswoman. We appreciate this opportunity to speak to your constituents. It's absolutely an honor. All right, as constituent service representative, our job is to serve as a liaison between Congresswoman's constituents and the federal agencies. Now, to break that down a little bit further, the Congresswoman is definitely aware that many times our federal agencies have not been as responsive as they need to her constituents. There are many reasons for this, but at this particular time, COVID has and continues to negatively affect how companies and government handle their business. And this is often to the detriment of the Congresswoman's constituents. So we're in place to help serve as I said, a liaison between the federal agencies and the people who need the help the most. All right, federal agencies have to respond to the Congressman's office. This is vital because many a times the constituents have attempted to call the agencies for days, weeks, and even months without any type of contact. So when we submit an inquiry on the constituent's behalf, we definitely know that we're going to get a response. Now, when I speak to constituents, I have to tell them, I have to manage expectations that I cannot guarantee that the response that we get from the agencies are always going to be to their favor. But what I can guarantee is that we are going to work extensively hard to the nth degree on their behalf so that they know that they are not by themselves. So first I want to do is cover how to submit an inquiry. I'm going to put it in the chat. And if you have any questions on this later on, you can reach our office at 404-659-0116. That's 404-659-0116. Now, the Congresswoman has supplied a link that will lead you to a form. It's completely fillable online. It'll allow you to put your information in it. It will also allow you to put the agency that you need specific help with. And it'll also allow you to just hit submit and it'll come directly to the office. It's easy breezy. After we receive that document, we will then proceed to submit it to the agency on your behalf. All right, so some of the things that we cover through the office, we cover IRS, we cover Social Security, we cover immigration, we cover United States Postal Service, and we cover passports, and that's just to name a few. Now, because of COVID, what we're finding out in the office that unemployment has become a huge issue for the Congressman's constituents. So Georgia Department of Labor does not exactly fall under our purview, but the Congressman has lent her voice to an initiative to really question why the Georgia Department of Labor is taking so long to be responsive. And the Congresswoman through her website will definitely be updating you on that process. Again, our office can be reached at 404-659-0116. I also want to cover in the short period of time with the IRS, many individuals are definitely going to be asking, where's my stimulus check? There are many people, Congressman, and we've had this conversation, who have not even received the second stimulus check. Now, as everybody knows, the stimulus payments are based on the 2019 tax return. There are many paper returns, and I'm not over exaggerating when I say approximately over 1 million tax returns that have yet to be processed. Paper tax returns have yet to be processed, which means these individuals have not received their stimulus payment. And definitely we understand the need. So if you have not received your if you're not received the second stimulus payment, possibly there may be a delay in the third. It's something that we are aware of, and it's something that we're going to have to face. We know that these times are hard. Although many feel that we're coming out of COVID, it is still here and the effects are still here. And please know that the Congresswoman's office is with you. Again, my name is Jared McKinley. We are here to assist. The Congresswoman has put us in place to assist. We are on the ground. We are in connection with these agencies, and we will do our darndest to make sure that you are served the way that you deserve. Again, my name is Jared McKinley. Our office phone number is 404-659-0116. And one last point. If you did not receive your $600 payment that the Congresswoman mentioned, you can file what's called a recovery refund credit. You can do that on your 2020 tax return. If you have already filed your return and saying, okay, am I out of luck? No, you're not. The IRS on irs.gov has a link and information that will tell you if you already filed your 2020 return, that you can file an amended return and still claim that credit. So that's irs.gov. We have more information for you. Contact us if you need us, 404-659-0116. Thank you so very much.
Thank you so much, Jared, and thank you for providing the information. If you call to the office needing assistance, Jared is definitely someone that you want to know, you want to be in touch with, and he's provided a phone number, and you can also reach out through our website. Jared has been burning the candle at every end, making sure that we get the constituents the help that they need in these times. And now I want to let you hear from some people who have been on the front line of this pandemic since day one, y'all. Some of you I've been on town hall with a year ago when this pandemic first started, and here we are now a year into this. Help is on the way. We can see the end in sight, but there's still more work to be done. And so I want to introduce you to our panelists for the evening. We have Commissioner Natalie Hall, who's the vice chair of the Fulton County Board of Commissioners. We have Jason Estevez, who's the board chair of Atlanta Public Schools. Dr. Cantos, assistant professor, the Division of Infectious Diseases at Emory University School of Medicine, and Dr. Lynn Paxton, director of the Fulton County Department of Health. Thank you all for taking time out of your very busy schedules to participate in this town hall and bring information back to the constituents of Georgia's 5th Congressional District. We're going to start by asking each of you to take 2 minutes to share how the American Rescue Plan has impacted your respective fields as you have continued to respond to the COVID pandemic. We'll start with you, Vice Chair Hall.
Thank you, Congresswoman. It is a pleasure to be here, and thank you so much for inviting me to speak to the nation about what's going on in Fulton County as it relates to the American Rescue Plan. In Fulton County, we are actually expecting over $206 million to Fulton County alone. We do estimate about $331 million will go to the Fulton County cities. So that gives us an estimated cost of $538 million infusion to Fulton County as a whole. The timing that we expect for the receipt of these funds will be paid in 2 tranches, 50% in 2021 within 60 days after enactment, and 50% no earlier than 12 months from the date of the first payment. And we expect the spending deadline to be December 31st, 2024. The reporting requirements we found were that periodic reports to the Treasury need to be made from March 3rd, 2021 until funds are fully expended. And the reports will cover how funds are used and how tax revenue was modified. Non-compliance results in repayment of funds to the U.S. Treasury are also expected. I do want to speak on some of the fiscal recovery funds, allowable uses of these funds. We can actually use them to respond to the public health emergency. And I'm so thankful to see Dr. Lynn Paxton, who is our Fulton County District Director for the Department of Board of Health on this Zoom, because she can address all of the health aspects of this, but we can use that funding for that in respect to COVID-19 or its negative economic impacts, including assistance to households, small businesses, and nonprofits, or aid to impact industries such as tourism, travel, and hospitality. And there's much more if you'd like for me to go on in the area of funding and how we can use it and how we cannot use it.
I'm sure there will be a number of questions that come up as constituents want to know how they can access these funds and how funds are directly coming back to them. Thank you so much for sharing that update, Vice Chair Hall.
Thank you.
Next, we're going to hear from Jason Estevez, Board Chair of Atlanta Public Schools.
Thank you so much, Congresswoman Williams. And on behalf of the Atlanta School Board and Atlanta Public Schools, I wanted to say hello to everyone in District 5. As a District 5 constituent myself, thank you so much, Congresswoman, for all the fight and the advocacy that you're doing up on Capitol Hill. Because of the work of you and your colleagues, Atlanta Public Schools is receiving $203 million as part of the American Rescue Act. And that money will be put into good use. We have been facing, as we all have, a challenging year with COVID. And because of the pandemic, we've had to make a lot of adjustments. The first semester in Atlanta Public Schools was virtual, as you know, Congresswoman Williams, very, very well.
Kindergarten was hard, Jason.
And as my kindergarten will tell you, yes, it was extremely difficult. But
harder
luckily,
for the adults.
yes, that touche. And fortunately, for both of our sons, they were able to go back in January. And the only reason we were able to do that is because we had funding from the federal government. Because as many of you know, the state actually cut the public education budget almost in half earlier this year. And that significantly hurt public schools. But because of the work of the federal government, because of the work of you, Congressman Williams, we have the money that we need to not only buy the supplies like the PPE, like the foggers, the clean buses, the wipes that so many of our schools need, to do the extra cleaning that many of our school buildings need each week, but to also do innovative things like surveillance testing. We are one of the only school districts in the state that is proactively testing our students, our staff across the district. And because of this funding, we are able to conduct thousands of tests each week and to catch folks who may be asymptomatic, but because they're asymptomatic, they could ultimately spread the disease. So we've been able to identify those folks before anything happens. And fortunately, because of that program, we have not had to shut down an APS school since we've opened. So we've been fortunate in that. Not only is the funds being used for actual things, PPE and testing, but it's also being used to hire people. We've had to hire lots of instructional staff to make up for some of the teachers who are remote, working from home. We've had to hire substitutes. We've had to hire additional operational staff for cleaning, and we've had to hire additional medical staff. Our medical team was relatively small prior to the pandemic, and now we have dozens of nurses. We have dozens of medical folks who are supporting us in our efforts to open schools. And aside from the immediate needs, this money will also be used for the long term. As all of you know, our kids, our teachers, our staff have been impacted significantly by this pandemic. And because of that, we're going to be able to use this money to help them, whether it's with mental health, which is a big issue that many of our students face, making sure that we have the appropriate number of counselors and mental health therapists in schools, but also things like interventions and literacy programs, numeracy programs. A deep dive into those two areas is needed to help with the opportunity loss that was experienced because of this pandemic. So look for APS and school districts across the metro area to double down on their literacy programs, to double down on things like summer programming, and offer it more widely and more broadly than they have in the past. And the only reason we're able to do that is because of the American Rescue Plan. So that's it for me, but that's a lot. And again, I want to thank you, Congresswoman, because certainly these funds are being put to good use.
Thank you so much, Jason, and thank you for taking care of my baby and all of our babies in APS every day. Next, we're going to hear from Dr. Cantos, Assistant Professor, Division of Infectious Diseases at Emory University School of Medicine.
Hi, good evening, everyone. Thank you for the invitation and for having me here. I think the American Rescue Plan has impacted the field that I work with, which is infectious diseases, in several ways. So the first one is the expand the coverage for COVID-19 vaccines and for treatment. So my clinical work is done at Grady Memorial Hospital, where we offer all of these treatments for COVID-19, including remdesivir and others, including people who don't have any insurance, obviously, as Grady is a safety net hospital of Atlanta. Besides this, I agree with you, Representative, that expanding, hoping that Georgia is one of the states that expand Medicaid is so important for your constituents, because it will allow them to optimize access to care, especially among minority communities, including Black and Latino communities that we serve at Grady. And lastly, not only the health-related portions of the American Rescue Plan, but also in terms of housing, in terms of how our assistant with, helping the community overcome the struggles that they face for a year now with COVID is virtually important with us. Housing is a health need. It is related to improved health outcomes. So that is something that I'm really appreciative of, and all of the effort that you're putting for that plan to come through. Thank you.
Thank you so much. And now we're going to hear from Dr. Lynn Paxton. And y'all, I was joking with Dr. Paxton when we were on earlier that I feel like she and I have been through this we've come full circle now, 1 year in, because a year ago this week, Dr. Paxton, I just saw the Facebook memory. We had a town hall in my role as a state senator around COVID and how do people get tests and where could they go and what should people be doing? And now we've come a long way in a year. And we're here to talk about vaccines. So tell us how the American Rescue Plan is impacting your work and what you're able to do 1 year into this pandemic.
Well, I have to say, one of the nicest things, I always like sort of being the last in the roundup, the panelists, because almost everything that I was going to say has been said, which spares me from having to, say it again, because everything that has already been mentioned has been, something that we have seen at the Board of Health. But I think I'm going to keep it this really short and sweet. In that, how has the ARA helped us? We could not do what we're doing without it. In terms of the Fulton County Board of Health, we get our money. We're not given a direct grant from the ARA, but we get it from the funds coming to us through Fulton County and from the state. And so with that money, we're using that to get those vaccinations out. And I'm so happy to be able to say just today that today at Mercedes-Benz Stadium, the Fulton County Board of Health has passed the 100,000 mark for vaccines being given out. And because we have other sites that we have been working at, we expect that by tomorrow, if you take all the Fulton County Board of Health sites together, we will pass the 200,000 mark for vaccines being given out. And so, yes, I'm back, patting ourselves on the back but all of that, we couldn't have done it without the funds and the support and the other things that are coming to us, particularly through the ARA. So, really, that's it. I can just say that this would not have been possible without that support.
Thank you so much, Dr. Paxton. And thank you all for just sharing a little bit about in your individual lanes. Before we started the town hall, we gave constituents an opportunity to submit questions. And I am going to roll right into the questions with the first one for you, Vice Chair Hall. A constituent said, I'm in between jobs right now, and I'm worried about falling behind on my rent. I'm glad that there's still a pause on evictions, but I want to use whatever resources I can to stay current on my payments. How do you recommend I find out information about state and local governments distributing rental assistance from the American Rescue Plan?
Well, let me say this. If you live in Fulton County actually has a rental and utilities assistance program. And when we started it, the applications came in just overwhelming numbers until we had to literally shut the program down just so we can have time enough to review all the applications and vet them to make sure that those people who actually qualified for the rental and utilities assistance were able to go through our program, or if they needed to go to another program. We have our Fulton County executives and staff looked at the situation about people possibly coming through Fulton County, and they may need to be referred over to the city of Atlanta because we cannot provide the funding to them to cover that if they live in the city of Atlanta, which is inside of Fulton County. However, the city of Atlanta received their own funds, and as you stated, the state. So we have a process in place so that we can transition those people and direct them where they need to go, and they will get that help if they do not only live in Fulton County outside of those cities that already receive funding.
And this is a follow-up to that question, Vice Chair Hall. The American Rescue Plan spent a lot of money on help for state and local governments. What is this relief for exactly, and what benefit does it have for people like me who are in between jobs?
So there is a work source. There's a work source component that allows for assisting people with jobs. Fulton County has an office called WorkSource Fulton, and they focus on training people for new industries if they've lost their job and that industry is shut down. They also have job opportunities for Fulton County residents. And so the CARES Act, the American Rescue Plan, is going to allow us to have more funding available in those areas. But also, we have to look at those industries that do hire people, and we need to infuse them with the funds they need, such as the nonprofits and the small businesses. And we do have the ability to do that as well.
Thank you so much. The next question is for you, Chair Estevez. As Atlanta Public Schools transitions to full-time in-person learning, what are you all doing to ensure that both teachers and students are protected from COVID-19?
Yeah, so I appreciate that question, and I want to shout out Dr. Paxton because in partnership with Fulton County's Department of Health, we have been able to offer mass vaccination events for our teachers, and we anticipate in working with them as well that we'll be able to offer that to students as well. And obviously for students that's more long-term, but we're working on holding these mass vaccination events, in addition to encouraging everyone to get their vaccine, whether you're a teacher, whether you're a student that's eligible, 16 and above are eligible right now, or parents. So we're encouraging everyone to get their vaccine. The second thing is that we're doing things like requiring masks in schools, in our school buildings. Atlanta Public Schools is one of the school districts that does require that. We're doing social distancing in our classrooms. We also provide PPE to our staff. We provide PPE to our schools to make sure that they have the supplies they need. And then not only that, but we have a considerable amount of folks who are still virtual. So we are able to have the social distancing necessary because only about 40% of our district is in buildings at this point. So we do our best to follow CDC recommendations and guidelines, and we will continue to do that until this pandemic is over. And I think that's a great reminder for folks that this pandemic is not over. So as we continue on this school year, where we've had our modifications for this school year, next school year, we're going to 5 days a week. face-to-face for everyone who opts in. But we anticipate that we'll still need, even then, some social distancing, some sort of masking may be required, depending on how many people have been vaccinated across the metro area and across the country. So just stay tuned for more interventions by the school system, but we are certainly going to always do our best to follow CDC guidelines.
Thank you for that. The next question for you, Chair Estevez, is, as of March 8th, teachers and staff have been eligible for vaccines in Georgia. What success has APS had in ensuring that staff are vaccinated?
Yeah, so that goes back to the event that I talked about earlier with Dr. Paxton's Department of Health, where we had almost 2,000 teachers vaccinated in the course of 3 days. That's on top of having teachers who were at risk vaccinated back in January. We had about 500 teachers who were vaccinated then. And then as soon as the broader teaching population became eligible, we encouraged teachers to make individual appointments, which many of them did. What we're going to do is we're going to not only have a second event to make sure that people get their second doses in April, but we're also going to follow up with all of our teachers and staff. And we have to keep in mind that it's more than just teachers. It's also staff members, whether it's the custodian, whether it's the food worker, the bus driver, making sure that they get vaccinated. We're gonna follow up with our employees to see who's gotten vaccinated and who hasn't. And if someone needs assistance in receiving the vaccination, we're gonna do it, particularly to the extent they haven't done so already. So we are doing our best to not only make it easy for our employees to get vaccinated, but we are proactively reaching out to them to make sure that they have the information that they need. And one last thing that I'll say is that we've also had a couple of events like this, where we've had professionals come and speak to our employees, speak to our stakeholders. Just a few weeks ago, we had Dr. Carlos Del Rio and Dr. Jody Guest come and speak about the vaccine, its efficacy, potential side effects, concerns that people had. And that was broadcast to our employees and to our community. So it's all in, and we do this hand in hand with each other, but APS is certainly trying to do its part in getting folks vaccinated.
So, and one last question, which came in from someone who is watching live around the American Rescue Plan and APS funding. And I don't know how far we are into planning the summer, but I know a lot of parents are starting to think about summer plans and what resources are available. And the question is, does the American Rescue Plan afford any funding for APS to extend free childcare or educational offerings over the summer for parents and families in need?
That was almost like it was planted, because I just got an email detailing.
It's from Terry Dill, who is on tonight watching live. So not a plant, a constituent who wants the answer.
No, so this summer, I talked about the opportunity loss, the learning loss that so many folks have talked about during this pandemic. And this summer, APS is going to have a summer academy that is for all students, pre-K or K through 12. And they will be held in sites throughout the school district for the month of June. So it's going to be a 4-week program, free of charge. Transportation is included to the extent that you don't live within walking distance of the school. Food is included. And it's a full day of in the morning. It's literacy and numeracy lessons, and in the afternoon, we call it the Power Up program, but it's enrichment programming, right? And we're going to do that for elementary and middle school. For high school, it's intended to be more credit recovery there, and that's a program that's $13 million that is fully funded by federal dollars. It's fully funded by money that's coming from the American Rescue Plan. And then not only that, we are also providing childcare for staff that are working this academy. And we're doing that at a cost of about $2.3 million, again, using these federal dollars. So this money is going a long way to not only the traditional academic year, but also the summer. And I fully anticipate that this summer program will happen again next summer and likely the summer after that, just to be able to provide our students and our teachers with more time with each other to make up for lost time.
Thank you so much. Now, our next question is for Dr. Cantos. The question is, I'm fully vaccinated now, but I've kept wearing my mask and social distancing. Is this something that I need to keep doing to avoid possibly being a carrier to others who haven't been vaccinated yet?
That is my favorite question lately. I love that question. And the reason is, you know, for a long time, everything was restrictions, mask, distance, you know, don't go to crowded spaces, and that still applies. That said, the CDC just came out with new recommendations for people who have been fully vaccinated, which I want to spread the word in the community because it's the first time that there's some sense of relief and of like lowering the guard in certain circumstances, which are these ones. In a household that is fully vaccinated, that all the members are vaccinated, and then there's another household that is also fully vaccinated, these two households can be together indoors without masks.
We've all been waiting for that.
I know. And then, so when I say fully vaccinated, you understand that it's 2 weeks after receiving your second dose. That's when your immune system has reached its optimal level of protection. So what does this mean? This means that if a household is fully vaccinated and then grandma is fully vaccinated and lives by herself, you know, you can go visit her, you can hug her, you can stop wearing masks. This is amazing. And this is something that, you know, is thanks to one, the vaccines, and two, the great work in vaccination, because, you know, vaccines don't really save lives. It's the vaccination that saves the life, that vaccines in the arms of the people. So that's one good news. Referring to the specific question, if anyone is in a public setting, as of now, we still recommend that you wear your mask, you distance, you wash your hands, you avoid crowds. And the reason for this is that we don't know in a, you know, public environment who is vaccinated, and two, who is unvaccinated and vulnerable. So we know we have some data coming from vaccines saying that the risk of a vaccinated people to carry asymptomatic infection and spreading it to other people is low, very low. But until we have reached that threshold of 70 to 80% vaccination coverage in the community, we still recommend that to, you know, narrow the that little risk of, you know, someone who has been vaccinated who's spreading the virus to be even lower. And, you know, even though we know vaccines work, you know, the efficacy numbers of like over 90% is something incredible, but they're not 100%. So they're until we have reached, like I said, this like quote unquote herd immunity, well, most of the population has been vaccinated. That's why we still recommend using face mask and separate distance and all that. But once we reach that number, hopefully we will be able to go back to number, and hopefully that will serve as a motivation for all of us to get vaccinated. And the best time to get vaccinated is as soon as you get your appointment. So the time is now. We can do this. It will protect us individually, it will protect our community, it will protect our country, and we will be able to go back to normal, which is something that we've all been longing for a year already.
Well, I am fully vaccinated, Dr. Cantos. I got the Pfizer vaccine, and I am beyond the 2 weeks past my second dose. My husband got the Johnson & Johnson vaccine, and he's fully vaccinated, and he's beyond the 2 weeks. So we are ready to have some vaccinated only gathering at our home. We're gonna be checking your little vaccination cards at the door. You're not coming in without it. So along that vein, I got the Pfizer vaccine. My husband got Johnson & Johnson, and we all know that there's the Moderna vaccine. And the question is, from a constituent, I keep hearing that certain vaccine brands have some advantages over others. I have pre-existing conditions and want to make sure that I'm safe, that I'm as safe from COVID as possible. Should I hold out for any specific vaccine type, or just get whatever is available as soon as I can?
Mm-hmm. So the best answer for this is that the best vaccine is the one you get. Meaning, yes, there are differences in terms of the numbers of efficacy between Pfizer and Johnson & Johnson. Pfizer and Moderna require 2 doses. Johnson & Johnson also only requires 1 dose. So there are like small differences in the numbers based on the clinical trials data. But the common thing is that all vaccine candidates approved in the United States overwhelmingly protect people from developing severe COVID, meaning having to be hospitalized for COVID, having to be put in mechanical ventilation, and preventing death, all of them. Like more than 90%. And that's what we really care about, right? If COVID was just another cold, who cares? What we care about is that in some vulnerable population, COVID causes severe disease, hospitalizations, intubation, death, etc. So
this is kind of along that same vein, Dr. Cantos. The question is, I'm vaccinated, but my best friend is nervous about it and keeps saying that she wants to wait until early summer to schedule her appointment. What can I tell her about the safety and effectiveness of COVID vaccination that might help her act more quickly?
So vaccine hesitancy and vaccine watchful waiting is very common in our community, and it's understandable because many factors that we can spend hours talking about. So I think the most important thing that the friend can do, if this is a trusted friend, is to share with her first her experience, saying, I got the vaccine, this is what I experienced, and this is what I have learned. And then point her to honest and trustworthy sources of information so she can gather all the information that she needs and then make an educated, decision and say, okay, I feel empowered now to make the decision. The issue is that the more time we wait to get vaccinated, the more time that we're vulnerable for COVID. And the more time that we wait to get vaccinated, the longer it will take our community to be fully protected from COVID. And a lot of people would like to wait to see, how other people do, if you got it, maybe I'm okay to get it and all that. But, millions of people worldwide have gotten all of these 3 vaccines and they are safe. And you can, look, they are reactogenic, meaning that in some people you may get, pain and like a little fever and feel, sick for a couple of days, but that's expected. And overall, these are otherwise very safe vaccines. So those are the things that I will tell her as pointers. And that's what we've been doing in the work that we do with the community.
I will share that after my second dose of the Pfizer vaccine, I was sleepy the entire next day. I slept for about 18 hours, but it was probably some rest that I really needed. And I got back out there, and now I'm fully vaccinated, and I could not be more happy.
Yep, it's your
Jason?
body. It's your body preparing and you know, learning how to fight a potential exposure to COVID in the future.
And I think it depends, because I got my second one yesterday. My wife had the same symptoms as you, Congresswoman, but I got my second vaccine yesterday, and so far it's okay. Although I'm you know, we'll see what happens, but it varies. It varies on.
Oh, the day after my second vaccine, I probably would have canceled my own town hall, Jason, because I was like, I can't. I'm just gonna sleep. Our next question is for you, Dr. Paxton. Dr. Paxton, the question is, I've heard about some people having a hard time getting an appointment for their second vaccine after already getting their first. If that happens, what should we do?
Well, if that happens, all you need to do is just contact us. Well, you know, or best is, of course, if you got the vaccine from someplace else, like a CVS or a Walgreens or whatever, you know, always first go to the place where you got your first vaccine, because the allocations are made so that every group that gives out a first vaccine should get a separate allocation to give out the second one. And of course, if you got it from us, you know, through the Board of Health, you simply, I would just suggest is giving us a call, calling the COVID hotline. The number is 404-613-8150. And you can just explain that, and they can make you an appointment. You can also contact us via email at the Fulton County Board of Health, the info line, which I forgot the actual email address, but it's pretty easy to find. So we can always, if you've had your first shot, we will make sure that you get your second shot.
And what was the COVID hotline number, Dr. Paxton?
404-613-8150. So that can always be your go-to number for anyone who has any particular questions.
Yes, I have to say, you know, if I can intercede real quick. So
Yes.
I think I'm a vaccine mission person now. So I take care of people living with HIV in the clinic. And as part of their visit, I asked them, you know, how they are doing in their COVID vaccine. And if they haven't and they're having issues logging in, then I just do it right there at the visit with them, for them and whoever else they want me to do it. And I did have an issue I listed the same email for two people because only one person had an email. And it was telling me that you're already on the system. And I called the number, and a very nice lady answered immediately. I didn't have to wait at all. And she's like, yeah, I can fix that. And then that was it. So it works. That number, the COVID hotline works.
So call the COVID hotline number, y'all, and we will make sure, can someone from our team drop that in the chat box and post it on the Facebook Live in the comments so that we have the COVID vaccine hotline. The next question for you, Dr. Paxton. My elderly parent lives with me and hasn't been vaccinated yet. I haven't had a chance to make her an appointment, but I want to make sure that she's prioritized for a vaccine as soon as possible. What's the fastest way to get an appointment?
Well, the fastest, easiest way is to, you know, make an appointment online. If you go to www.fultoncountyga.gov, that is how you'll quickly see ways to make your appointment. And so we put the majority of our appointments onto that system. That's a statewide system. And when you get into it, it's a statewide system. And so you tell the system like where you live, and it'll show you the locations where you can get vaccinated. So that's one way. If he's asking for the fastest ways, there are many places that are doing vaccinations. And so I do refer people to the Georgia Department of Public Health website, their COVID vaccine locator. You go onto that website, you put down what county you're in, and boom, up pops up what pharmacies health systems, whatever, are offering vaccinations. And so you can go there, and so you can look and see, oh, well, my local CVS or my local Walgreens is open, and it'll show you how to give the site that you can go and make an appointment. The third thing is, I always remind people, don't forget about, if you have a primary care physician, probably should be speaking to him or her, because it might be that their health system is providing vaccinations, or they might be able to direct you someplace else. So, I mean, there are multiple ways of getting vaccinated. And for those, again, for people who do not have access to the internet, because we realize there are many people who do not, and particularly we know that there are many elderly people, elderly being defined always as 5 years older than I am, who have, are not maybe necessarily so conversant with, using the internet. And so again, the magic number that I just gave, the COVID hotline, is one that should be used, so they can call up and say that, I need an appointment, and you can get help that way too. So I'm just saying there are multiple avenues to make, to get an appointment for COVID vaccination.
Thank you. And then the one last question that came in for you, Dr. Paxton. I'm worried about Governor Kemp's plans to roll back additional rules to protect people from COVID. What advice should I give my friends and neighbors to stay safe until everyone can be vaccinated?
Yeah, well, absolutely. I mean, like, I have no particular sway, unfortunately, over, determining what are the, laws and regulations and all that. But everyone can work to protect themselves. And so I sound like a broken record. How many times, Congresswoman Williams, have you heard me say, wear a mask, socially distance, keep to, small gatherings. So almost regardless of what's happening in the legislative world or whatever, people can still make individual decisions for themselves to protect themselves. So for example, don't go to spring break in Florida. I think I can kind of say that pretty conclusively. That's a bad idea. And so you don't have to do that, and shouldn't do it. I mean, I do this all the time. If I go into a restaurant or see something like that, and I see that it doesn't look safe, I turn around and I go to another one. I mean, so sometimes it's just a series of making smart choices for yourself and for your family. And of course, the most important choice is go out and get vaccinated. And one thing I should mention this, of course, for the Atlanta public school system. I don't know if you're aware that today the manufacturers of the Pfizer vaccine announced that their study, which they're looking at all age groups, all children, but they've looked at their 12 to 16-year-olds, that the vaccine is just is 100% effective in them as well. And so quite soon they are going to be applying for an extension of their present emergency use authorization, so we can start vaccinating kids as young as 12. And they also said that even in their younger age groups, the preliminary results are looking just the same. So very soon, and we were talking about this just today at the Board of Health, is that we're going to be sitting down working with the schools, because all these kids are all in school in some way or another. And so I think we're going to have to figuring out a strategy for how to get all these kids as well vaccinated. So that's not for this week or not even next week, but it's coming down the pike. So we're going to be we're thinking ahead to how we're going to cater to that. So the important thing is everybody everybody should get vaccinated as soon as they possibly can, and they should continue to do all the prevention things that we already know work.
So Dr. Paxton, I see a conversation coming between me and you and Chair Estevez coming down the line to talk more about our children when that conversation is more relevant. I was on the phone telling someone that I was vaccinated and my husband was vaccinated, and I have a quite precocious 5-year-old in the background saying, "Mommy, but I'm not vaccinated yet." So Carter is looking forward to his vaccination because he misses play dates and he is ready.
Good. Well, his time will come.
So now we're going to take some live questions from the audience, and I'm going to turn it back over to Bernadine to share how we're going to handle this portion of the question and answer session. Bernadine?
I'm trying to turn my video back on. Okay. So thank you, Congresswoman. If you haven't done so already, please submit your questions using the Q&A feature at the bottom of your screen. Please know that the Congresswoman's goal during this town hall is to answer as many questions as possible. We do anticipate a high volume of questions this evening, so thank you for your patience as we attempt to answer as many questions as possible. We will now take the first question, Congresswoman.
The first question that we have is from Sasha Vinson. Sasha said, thank you for your support for stimulus funding that will provide much needed relief for parents, staff, and child care center owners. We've heard that Democrats are working to include the $15 minimum wage in the next stimulus bill. While we believe our child care staff deserve higher wages, personnel, employee wages, and benefits already make up 70 to 80% of the cost of child care currently. The families we serve simply cannot afford to absorb that cost associated with increasing the minimum wage. What permanent assistance do you propose to help child care centers pay staff at the increased minimum wage while not raising tuition rates on already financially stretched families? Sasha, I hear you loud and clear around not relaying these costs on to families who are already struggling to pay for childcare. I can tell you that I was doing the countdown to kindergarten so that I could remove childcare from a line item in my budget. We unfortunately were not able to get the $15 an hour minimum wage increase included in the American Rescue Plan, but I will be upfront with you that I am still working on this because Americans deserve a raise in this country. So while we're still working on that, I will tell you that the American Rescue Plan included $39 billion for childcare providers. The funds these funds providers can use to help maintain their payroll and staff, as well as many other costs associated with maintaining childcare services. And in addition, just rolled out today that a lot of people probably have not even heard about, is in the new jobs plan and the infrastructure plan that President Biden rolled out. I was up bright and early at 5:30 this morning, reading through the details to see what exactly was going to be included. And we're looking at including childcare as a part of infrastructure in this country, something that has never been done before, but is greatly needed because care and care workers are essential to our economy working. So there's permanent help on the way to help our child care providers and care providers generally in this country. So thank you for that question, Sasha. The next question is from Jeff Breedlove in Grant Park. Jeff's question is, as a constituent from Grant Park and a person in long-term recovery from substance abuse use disorder, I'm interested in the funding which will be available for peer-led recovery organizations, such as the Georgia Council on Substance Abuse. Thank you, Jeff. I can always count on you to join my town halls. Y'all, I have made a commitment that I will do a monthly town hall to bring information back to our constituents. And this is our third town hall since I was sworn into Congress on January 3rd. And Jeff has been on every town hall and is an advocate to make sure that we get resources back to the people that need them on the ground. And Jeff, the American Rescue Plan prioritized behavioral and mental health resources, specifically $1.5 billion for substance abuse prevention and the treatment block grant program, which helps to ensure community-based organizations can provide substance abuse prevention, treatment, and recovery services. And we will be happy to dig more into that with you, with someone from the office. So thank you so much for always being an active and engaged constituent. The next question is for you, Vice Chair Hall. And it is from Justin Smith. Justin's question is, it's a gentleman that works in my building, and he mentioned that he's behind on his rent and can't seem to secure funding. What are the resources that are available to him, and how does he access them?
If this gentleman lives in Fulton County, he can go to our website at fultoncountyga.gov. And our rental assistance program right now, unfortunately, it is shut down while we review the applications. We received over tens of thousands of applications when we opened up, and we only had so much funding. But the bright side of this is that the American Rescue Plan will infuse us once again to have more funding in the area of rental and utilities assistance. Or you can always have him contact me via email at natalie.hall@fultoncountyga.gov, or he can call my office at 404-612-8226. And please, if you call, leave a message, because we still do have the COVID-19 restrictions on our office space, and we are not always there in the office. So if you leave a message, the voicemail will turn into an email, which would actually go directly to our county phones in my office.
Thank you, Vice Chair Hall. The next question is an anonymous question, and it reads, recent college graduates under 26 years old who are still dependents on their parents' tax returns miss out on stimulus support because they have not filed returns and are no longer enrolled at a college or university. They're not eligible for stimulus support or the HERE grants dispersed from colleges to actively enrolled students. How can we ensure that recent college graduates benefit from stimulus packages that are passed through from student grants through colleges and universities? So that is true. Under age of 26. So the age of 26, I think, is a number that was used to allow dependents to remain on their parents' health insurance, but that age is not used for dependency status overall. Adult dependents 17 and older are eligible for stimulus payments for the first time under the American Rescue Plan Act. The taxpayer must claim the dependent, and they have to meet certain income requirements to be eligible for the payments. $75,000 for single filers and $150,000 annually for families filing jointly. And the stimulus payment would be $1,400 for the dependent. If you need further assistance with this, please reach out to our office, and Jarrett McKinley, who you heard from earlier, will be happy to assist you with this. The next question is for you, Dr. Paxton. From Jerry Butterworth. How can a retired healthcare professional volunteer with COVID vaccinations?
Yes, I think I answered that in the typed answer in the chat, because there's a couple of websites there. Basically, what we ask is that people, if you are a retired medical professional, and in fact, even if you're not, but for the medical professionals, we ask that you sign up for the Medical Reserve Corps, which is actually throughout all of Georgia, but you can sign up by county. And you do that at the Serve Georgia website, which is www.servga.gov. And then there'll be a drop-down menu in which you select the county that you would like to, whose MRC you'd like to join. And I presume that everyone who's on this call would be selecting Fulton. And then you sign up on that website. It's going to ask you to provide, what's your, if you have a license number, what it is, and stuff like that. And then once you've done that, let us know. Then you can just you can contact our medical volunteer coordinator, who is our chief nurse at the Board of Health, Michelle McLeod, and I put her her email address in the chat as well. So basically, sign up at servegeorgia.gov for the Medical Reserve Corps. Pick Fulton County. Once you have finished that, then contact Michelle McLeod to let her know. And that's the list that we use to pull most of our medical volunteers from.
Thank you, Dr. Paxton. And we'll make sure we have 2 viewing options for constituents tonight on Facebook Live as well as through the Zoom. So some of these questions are coming from the Facebook Live audience and might not have seen the response in the chat.
Okay. Mm-hmm.
Our next question is from Ellen Reynolds. Ellen's question reads, as CEO of the Georgia Child Care Association, which represents the 3,200 licensed child care centers in Georgia, We want to thank you for supporting funding to strengthen the child care infrastructure in Georgia that has been ravaged by the pandemic. With that being said, my question is, what are you doing to include child care providers in discussions to understand the unintended effects mandating universal 3 and 4-year-old pre-K could have on access to child care, especially for infants and toddlers, since infant and toddler tuition does not cover the cost of care? So I support universal care, period. Whether that is, and I know that, and Chair Estevez, feel free to chime in, that when we're talking about pre-K across the board, right now, we don't even have pre-K available for every 4-year-old in this state, let alone 3-year-olds. That is something I'm always going to strive for, early interventions. And I am not going to, and I know this is probably not the answer that someone in the with the Georgia Child Care Association wants to hear, but I'm not going to put the cost of tuition of keeping childcare centers open above making sure that children are getting early interventions with 3 and 4-year-old pre-K. Now, what we can talk about is care being a part of our permanent infrastructure in this country. We always talk about roads and bridges and how do we make sure that those infrastructure needs are taken care of. But I've been a huge proponent, and I come from a background of working with the National Domestic Workers Alliance and Care in Action, where I represented the 2.5 million domestic workers in this country, who included child care workers. So I know very well the need for care in this country and the cost of child care with a 5-year-old. And I am not kidding when I say I was doing a countdown to Carter starting pre-K, and I could take the line item for child care out of my budget. But there is a way to move forward in making care a permanent part of our infrastructure, where we are not looking at pitting the needs for children getting universal pre-K above the needs of keeping the child care facilities open. And I don't know if you want to comment on that, Chair Estevez.
I agree, Congresswoman, and I do think there are opportunities for entities to help us build a culture of care for young ones. The need for childcare should not be a barrier to career, should not be a barrier to your family thriving. And with Atlanta Public Schools in particular, we've been working with organizations like GEARS that works with many of the childcare providers to advocate at the Capitol, but they've also, GEARS has also been working with APS to work on expanding opportunities for childcare providers to provide early education in the city of Atlanta, not only through partnerships with APS, but also with partnerships through the city of Atlanta and private entities. So I appreciate Congresswoman Williams promoting the need for care to be part of really the fabric of our country. It isn't there yet, and we just need to continue to advocate for that, because it really should be standard for everyone.
Exactly. I say all the time that care and care workers make every other type of work possible, because we cannot, our economy can't reopen if we don't have people to help us care for it, not just our children, but even looking at it from the other end of the spectrum and our elderly and our seniors. So we need care and care workers for our economy to move forward. Our next question is from Carrie Dill, and this is for you, Vice Chair Hall. As Georgia Power is our only utility, can we ask them to meet Georgians' needs by proactively suggesting utility relief for residents who are behind on their power bill? So I don't know if there is anything that Fulton County has available for constituents who are behind on their power bills.
Well, we have our utilities assistance program, which is in conjunction with our rental assistance program. So we do help with the utilities. But I would also want to say that even if we don't legislate on that level through Fulton County, we can at least lobby for the legislation, because we have an external affairs department that handles intergovernmental affairs, and we have a lobbying firm that we hire to actually take our legislative packet across to the state and lobby for any changes in legislation that we see can help our constituents.
And the next question could be for you, Vice Chair Hall, if you maybe have the answer, and we might have to just schedule an additional follow-up for this, but it is from Lynn Brown McKinney, and she's asking specifically about Fulton County schools. So we've heard a lot about APS tonight, but do you have any insight on what is happening in Fulton County schools around the pandemic response and the American Rescue Plan?
Unfortunately not. Fulton County Schools has a whole different set of electeds that represent them. Fulton County Board of Commissioners, we do not do the work of the.
Oh, no, I understand that part. I just didn't know if you had conversations and had any updates that you could give. But since
none yet, not yet. But when
well, we will definitely get information and follow up on that and make sure that at our next town hall, we have a representative from Fulton County Schools. And Dr. Paxton said that everyone might choose to volunteer in Fulton, but Dr. Paxton, I represent Fulton County, DeKalb County, and Clayton County. So we might have some constituents from a couple of other counties on. So our next town hall, we will make sure that we have representatives from them on for our April town hall. That concludes the live questions that came in for the evening. And I think we are done with questions. Any more questions, Bernadine, that I missed?
No, that's the end of the questions that we have.
Well, thank y'all so much for joining me this evening. Thank you to our panelists for providing information. This has been recorded for sharing with our constituents and also was live streamed on Facebook and here on Zoom. As our nation continues to face challenges in coming out of this pandemic, I am certain that the Fighting Fifth District will overcome, because we always have, y'all. We're crushing this virus by putting vaccines in arms, like Dr. Kento said. It's not just the vaccine, it's the vaccination. So we need them in your arms. Continue to wear your mask. Continue to protect everyone, because we're all in this together, y'all. If we've learned anything over the past year, is that we have to work together to come out of this pandemic, and we will come out of it safer and stronger. Please know that I am working for you every step of the way to protect the interest of our people in our district that I was sent to Washington to serve. So stay safe, continue to wear your mask, protect everyone around you, and have a great evening. Bernadine is going to give just some information so that you know how to reach us if you need any follow-up information. And for our panelists, we're going to share the contact information that you shared as well if anyone needs to follow up. Bernadine?
Thank you, Congresswoman, and thank you to our distinguished panel for joining us tonight. For those of you who submitted questions and did not have your question answered, we apologize. But I think we went through all the questions as we are unable to get to everyone's question. If you would like to leave your comments and questions for our staff, please still place your questions in the Q&A or email your question to townhall5@mail.house.gov. We plan to schedule another town hall, as the Congresswoman mentioned, once a month. And we look forward to you registering and attending. You can visit the Congresswoman's website just to get updates at www.nikemawilliams.house.gov for the latest updates on the coronavirus, legislative actions, and to sign up for the newsletter. You can also call our district at 404-659-0116 or the DC office at 202-225-3801 if you have any other questions. Again, thank you for joining tonight's virtual town hall. Good night.